We're going to be talking about how cancer affects your fertility. It sounds ambiguous, but it could be very, very important when you're considering your reproductive potential. For some cancers, based on the stage, if it was early stage, some women who are still in the reproductive age and are still fertile, can try to cryopreserve their eggs. And even for men, they can cryopreserve their sperm cells for future use, either by themselves or through third-party reproductive techniques such as surrogacy. Now, how does this affect the whole process? If it was early stages of cancer, you need to come in early enough, get evaluated, get a pass from your oncologist, that is your cancer doctor, to tell you that it's okay for you to go ahead to be stimulated for this procedure. For men, it's a bit easier. All you have to do is to come in, see your gynae, see your fertility doctor, produce semen, within which you'll be ready to have your fertility treatment done. Now, based on the kind of cancer you may have had, if it was like endometrial cancer and your womb had to be taken out and all, I know that it could be a very difficult time, but do not close the door on your fertility potential. So this simply means that you could have a surrogate mother, a gestational carrier, to help carry your embryos. So when you're ready to have your babies, go into the cryobank, speak to your embryologist, speak to your doctor, and then have your eggs fertilized, either husband's sperm, your partner's sperm, or your donor's sperm, as the case may be. And when the embryos are formed, they're put into your surrogate mother, that's the gestational carrier, and you have your baby. So do not close the door to your fertility potential. So there are top cancers in the female. One of them is breast cancer. If you do not have family history, or even if you have family history, the self-breast examination is very key. You should do that every morning when you're having your bath or at specific times of your cycle. That will help you to know what your breast is. Some people have lumpy breasts and some do not. So you know what your normal breast feels. And when there is anything abnormal, either you're having abnormal nipple discharge, that's bloody discharge, abnormal discoloration, size, or even masses within the breast, it's important that you notify your doctor. Another thing you can do for other types of cancer, like cervical cancer, that is a highly preventable cancer. The major cause of cervical cancer is HPV virus, that's the human papilloma virus. And how can you check for it? Once you've established sexual debut and you're in your reproductive age, based on the fine criteria, you should go in and have your cervix checked by doing your pap smear, that's your cytology, or going in to check for HPV within it. And if it is found or not found, they give you a routine to come every 5 years or every 3 years, as the case may be. And once you're said to be okay, and your doctor certifies you can go on to have your HPV vaccine. It's affordable, it's available, and it will prevent a possibility of having cervical cancer. So today I'm talking about 2 major important cancers. So that's what I've said now. So see you next time. Make sure you put thumbs up to this video, subscribe to our channel so that you can know more about your health and how best to take care of yourself. Also, you turn on your notification buttons so that when we have a new video, you can also view. And I say kudos to all cancer survivors, and I'll say let's take our health seriously. Many of these cancers are preventable. Love you and see you later.